The three cases include two Singapore citizens who have no recent travel history to China, but have been admitted with symptoms, and both of them have links to a church, and this is a Grace Assembly of God church. The third case is a Singapore citizen, again with no recent travel history to China, and he remains admitted in hospital. Prior to his admission, he worked at DBS at Marina Bay Financial Center. He also is currently admitted for treatment. We have established several links to previous clusters through further epidemiological and contact tracing processes, and this has been made possible with the assistance also of the Singapore Police Force. Several of the cases are linked to the Life Church and Missions at Singapore, and this was previously announced as well. There are also 9 confirmed cases that were linked to the cluster associated with the Yongtang Tai Hang, and this is associated with the tour group that had come from China. 3 confirmed cases are linked to a private business meeting held at the Grand Hyatt, Singapore. 2 of the confirmed cases are linked to a work site at Seletar Aerospace Heights. And as I just mentioned, 2 new cases, both of which are linked to Grace Assembly of God Church. We have noticed that several of the clusters are associated with places where people might aggregate together for activities, and this includes the church. And we would want to remind particularly all members of the congregation for these churches to continue to monitor themselves and make sure that they remain in good health. And if they find that they are unwell, particularly with respiratory symptoms, we would encourage them then to see a doctor as soon as is possible, to wear a mask on their way to see a doctor, and also while they are not well, not to travel and carry on their normal activities. And this is important also as part of being socially responsible. In fact, the advice I've just mentioned is an appropriate one in all settings as well. If you're ill, please don't go out and continue, your social activities. And this helps also to limit any spread of any infection. See a doctor early, wear a mask, and don't doctor hop, going from one doctor to another, because that also makes it difficult for doctors to establish whether or not you are sick and whether or not you've in fact been sick for a much more prolonged period of time. If you are on a leave of absence, then please also respect the instructions that are given to you under your leave of absence or home quarantine order. And again, please avoid contact with other people and avoid crowded places. At any time, if you're unwell, please inform the necessary people, and also then make your way to see a doctor as soon as is possible. If you're well, we would continue to encourage you to practice good hand hygiene, and that includes, in fact, washing your hands. That is the single best defense for any spread that will occur in the community and the public. We are aware there have been various letters, emails, WhatsApp messages sent on social media, all with good intentions by a variety of different people, including doctors. And they are all well-intentioned in order to encourage members of the public to engage in good activities to protect themselves. And some of the advice, in fact, is very relevant, and that includes advice and instructions to wash their hands. But it's important to remember that this infection, this virus, is spread by droplets or contamination of surfaces. And there's no established evidence that in the open, this virus spreads by the air or by aerosolization. So the best form of advice I can give you to defend yourself is, in fact, washing your hands regularly, frequently with soap and water, and also to be mindful of the things that you commonly touch. And the most common thing that you touch is your phone. And you might want to make sure that you clean the surfaces of your phone as well as you touch it. It's subconscious, we often do that, but these are the important things to make sure you protect yourself. It is not wearing a mask that is the most important, it's hand washing.